Claude, an IT software engineer, is a man who loves having a good shower, and his head never misses being thoroughly lathered. One day, 3 months back, as he was enjoying one of these, his hand slipped into nothingness on his scalp.
How did you feel that moment when you're showering, you touch, and then there is this patch, and you're wondering?
Of course, I had a lot of shock. Truth be told, when you're used to having a bigger afro and then you wake up the next morning and there's a patch in it, you'd have to be very afraid.
This left him disoriented and he sought medical help.
My doctor felt it could have been a fungal infection or something, so he gave me antibiotics for it. Nothing was improving, so I chose to consult another doctor. This one told me I had, an autoimmune infection. So I asked him, what is an autoimmune infection?
Normally the body acts against foreign bodies to try to kick them out. But in a few people, the body's immune system starts acting against itself. In this type of people, the body's immune system acts against the hair follicles and they start losing hair.
The disease is rare, and at Insambia Hospital, they see about 6 patients in a year.
In the Western world, about 2% of the people get this condition, which is hair loss in patches.
Most of the time, there are no other symptoms apart from hair loss, although some people feel a burning sensation or itching. Claude's condition is alopecia areata monolocularis, where a person has a single bald spot on the scalp. Other types include multilocularis, with multiple bald spots on the scalp. With alopecia barbae, the disease is limited only to the beard region. Sometimes all body hair, including pubic hair, is lost in a condition called alopecia areata universalis, and where women lose the frontal or temporal hair, it is traction alopecia. In alopecia areata totalis, the commonest, the patient loses all the hair on the scalp.
At the age of 50, about 50% of all men have lost some of their hair. And this is down to the hormones. Testosterone changed into another type of hormone in the body, and that kills off the hair follicles from which the hair grows gradually. Then of course you even have women who lose hair. So as women grow old, they lose estrogen, and estrogen is supposed to make hair supple, it's supposed to make hair long.
Alopecia is basically a skin disease.
How do you protect this patch? It needs protection. How do you protect it?
One of the doctors I saw gave me an antibiotic cream that she told me each time you shower, apply, at least twice in a day.
According to the National Alopecia Areata Foundation in the USA, although not life-threatening, alopecia areata or loss of hair is life-changing as it has psychological impacts.
Most of the time you're touching it and asking yourself, has anybody seen it? What are they thinking about me? So you keep dashing to a barber to make sure you cut off your hair most of the time.
Indeed, some people are grieved, those wear wigs fear being discovered, and some are withdrawn. Most people with it fear to have children because there is a 1 in 5 chance that they could spread it on to their children.
Most of the people who have this hair loss in patches, they've had a relative who has the same kind of hair loss.
I don't think it would stop me from having children.
It's not something that would distress you so much, because there is hope that your hair is going to grow again. In about 90 to 95%, this hair does grow.
And then probably reoccur once in a while.
Whether there is treatment or not, the patches actually grow hair.
However, one whose condition manifests for the first time after the age of 30, there is less likelihood to have another family member with the disease. Claude could be lucky after all. More likely to have other family members with it are those who develop their first patch before the age of 30. Florence Nalimba, NTV.